All right. Hello, everybody. Thanks for coming. We will just wait a couple minutes until more people arrive. We're at 12:02. We'll get started at 12:05 on the dot. Thanks. All right. Hi. Thank you again for those that have joined. We're just going to wait a couple more minutes for people to arrive, and then we will get started. Thanks again. All right, welcome everybody. It being 12:05, we will start the webinar, our state policy and budget update. So you all know this is being recorded, and we will post it on our website in the next couple days. So again, thanks for coming. It's been a wild and crazy year that is now halfway over. There was a lot that happened legislatively, even though it was a very short session. So we hope to give you some updates on that. And we're also going to give you an update on what's happening with childcare in the Restore Illinois efforts. We will go through the webinar. If you have any questions, please put it in the chat or questions area. There are a lot of people on this webinar, so we're going to keep it muted for the whole time. But again, please do not hesitate to put questions in the chat box, and we will try to get to them at the end. This webinar should take about 40 to 45 minutes, so we should have plenty of time for questions for everyone. So again, please don't hesitate. Thanks again. I'm going to turn it over to Maria to go through the agenda. Thank you.
Hi, everyone. Thanks for joining us today. This is Maria Eslin, Senior Policy Associate with Illinois Action for Children. And the voice you just heard, of course, was Samir Tana, our Director of Policy and Advocacy and Community Engagement. So today we are going to be talking a little bit about, a session recap, what happened with legislative session this year. We know it looked different than in past years. So we're going to talk about what that looked like and what the fiscal year 21 budget will look like for the coming year, and any relevant early childhood legislation. After that, we're going to talk also a little bit about some federal COVID-19 relief and some federal money that came into the state and what the state is doing with that to help us in the coming times, as we know, obviously there's less revenue, and we want to make sure that we have all the resources available to us. So we'll talk about what we have coming from the feds, and then also be diving into the Restore Illinois plan and what that means for childcare. What did it mean in phase 1 and 2 and 3? And now that the state has moved into phase 4, what does childcare look like? And what are some supports coming in the coming weeks? And we'll talk a little bit about some opportunities to engage in advocacy moving forward, and then spend some time on questions that you guys have. So I'm going to turn it back over to Samir to dive in.
All right, thank you, everyone. I apologize I did not introduce myself at the beginning. I'm a bad host. My mom would not be proud. But before we move on, I just want to take a moment to mention the passing of our dear leader, Maria Whelan, a couple of weeks ago. We are all at Illinois for Children heartbroken. She was our fearless leader. I think many of you in the early childhood community who've watched for the last 40 plus years, how dynamic and powerful she was in making things better for children and families in this state. We can only hope to carry on her legacy going forward. And thanks for all the well wishes that have been coming through. They're greatly appreciated. All right, so moving to what happened this legislative session. Due to COVID-19, legislative session was paused for the months of March and April and most of May. Legislators were trying to be safe and cautious about what was happening, and also modeling good behavior by staying at home and not going to work unless you absolutely had to or were required to because you were an essential worker. So by the end of May, it became clear that the legislature needed to return to Springfield to complete their business. The state fiscal year ends at the end of June. There is a self-imposed deadline for legislative session at the end of May, whereby anything that happens after May 31st, there must be a 60% approval on legislation to have an immediate start date. So the legislature decided to come back before the end of May to ensure that they only needed a simple majority to get most of the things that they needed passed. So they met, I believe it was 5 days, Wednesday, Thursday, Friday, and Saturday in Springfield to get the state budget done and about maybe 8 to 10 other extremely important legislative measures passed. And for us, it was very difficult. We're used to being in Springfield during legislative session all the time. Legislators are also used to having advocates in Springfield. If you've ever been to Springfield, many of you have. You just go to the chamber doors and catch your legislator as they're moving from one meeting to another. It is not necessarily a place for a lot of formalized meetings. So it was difficult for us. I think it was difficult for them. There was a lot of texting and understanding going back and forth because we weren't there to walk them through what was happening. But I feel like we did a fairly good job with a different strategy during this shortened session. And we'll see how that turns out going forward. So first, the state budget was passed, which was a good thing. It has been signed into law as of over a week ago. The budget is $42.9 billion, which is not a large increase from the previous year. These are general funds. It does not include pass-through federal funds that comes to the state. The biggest new chunk of money that's in here or in the revenue side is borrowing from the feds, and it's decked at $5 billion. They're allowed to borrow up to $5 billion from the feds. The feds have created a program that allows states to borrow straight from their Fed window, which banks are normally only allowed to get money from. The interest rate is extremely low, and as we'll talk about going forward, we hope that states are really hopeful that the borrowing, just like the PPP grants that many providers got, the borrowing will be forgiven in the future, so we will not have to pay it back. So next, there is an estimated $7.4 billion shortfall. That includes a revenue shortfall for this fiscal year that begins tomorrow. It also includes the need to pay back borrowing in the FY20 fiscal year to close that budget hole because of the severe loss in revenue in April and May and June. And so between those two shortfalls, it's about $7.4 billion. And if you recall, just on the previous slide, we're going to borrow about $5 billion from the Fed. So there is still a gap in there of over $2 billion that will likely be there without any additional federal relief, or as we'll again talk about later, the fair tax, which is on the ballot in November. So it still is a bit of a precarious situation here. The governor has been given some authority to move money around more so than he would have, or the governor would have in a normal budget year. So that is also looming over advocates, people who run programs, as well as the governor's office. And then I did move this up here. I had just a few minutes ago. The federal relief efforts, as I mentioned, the state did get some money from the feds, and they maybe have availability of more money, either through borrowing or through another appropriation. But so far, the state has received about $3.5 billion in direct COVID relief funds. In their budget, they set aside over $600 million for small businesses, which includes child care assistance centers and child care assistance program, as well as early learning programs that do not receive child care assistance. We will talk about that. There is for $450 million for household and community support programs, $800 million for healthcare providers, $250 million for local governments. That is likely not enough money going forward, as we know, when you pay property taxes or sales taxes, a lot of that goes to your local government. If people are not out spending, not only is the state receiving fewer dollars, your local governments are also receiving fewer dollars. Many of them are going to need a cash infusion as well. And then the biggest chunk was about $1.5 billion to state agencies. This includes programs like childcare received a big chunk of money, as well as other stabilizing funds to Head Start or TANF and programs like that to make sure that the state can meet its obligations going forward. In the state budget, most of what we're going to talk about now is actual state revenue dollars being dispersed. Overall, our appropriations were just about flat compared to FY20, considering the collapse in employment and revenue. We believe this is about as good as we could have hoped to receive. They're not talking about dollar amount cuts or program cuts going forward to early childhood programs. Demand and take up may be seeing a hit, but there's nothing purposefully being done to limit access to programs. As I mentioned, it's mostly flat. We did get an increase in a couple areas in state and federal funding, and I believe this is really indicative of the advocacy community and providers locally having made sure that their legislators really understand the importance of early childhood and why children need to have access to care, whether it's in July or August or starting in the fall. We have to make sure that children have access, and part of that is making sure that programs can stay around and can stay open and stay alive while demand for childcare is not going to be as high as it was at the beginning of March. So I hesitate to call it good news. I just will say that it is not. This is not bad news. So we'll go to the individual programs. So first, the Child Care Assistance Program. We are level funded for state dollars, which again, considering how big the program is and how bad the revenue shortfall for the state is, was nothing short of a victory here. We did receive more federal funding. So I don't know if you remember, about 12 years ago, back in December of 2019. It feels like it was forever ago. There was a federal budget deal that averted a federal shutdown that did increase funding to the Child Care Development Block Grant federally, and Illinois received $20 million of that increased appropriation. So that is in our federal appropriation, and then additionally, as part of the CARES Act, which was passed in, I believe it was April. Again, it feels so long ago. There was $3.5 billion for childcare in that budget, and that is one time. So Illinois' proportion of that is a little bit over $118 million. That money must be expended by the end of this calendar year. That can be used directly to childcare, but for anything that is COVID disruption related. So we've attempted to use that money so far around reducing copays for families and paying for emergency childcare. Those are examples of what we can use that money for. That money is actually appropriated in both FY20 and in FY21, just in case we weren't able to spend all that money in either fiscal year or we needed it for this fiscal year. So we'll be getting back to you on how that money was spent and where, and how it really made a difference for children and families and providers. Early intervention, this was a bright spot here. We did receive a $7.2 million increase up to $115.9 million. There's several things that this dollar amount can be used for. We've been advocating for the last couple of years on rate increases for early intervention providers. They received their first increase in nearly a decade. Last year, our goal was to have increases over 3 years to make sure that we have enough early intervention providers, individuals who are providing services, so that they can meet the growing caseload. As more children are getting into early childhood programs, be it Head Start, childcare, preschool, or some combination, children are being identified more and more as having delays, especially those birth to 3, and we need to make sure that all those children who have delays can actually receive therapeutic services to help mitigate those delays going forward. So hopefully, this money can be used to serve more children on the EI program. The Early Childhood Block Grant, which is in the State Board of Education budget. Again, I believe it was a victory that this was level funded at $542 million. Again, this program pays for preschool for all, half day, the preschool for all expansion, which is full day preschool, and then prevention initiatives for home visiting and center-based services for children birth to 3. Again, exciting. We're not quite sure what preschool is going to look like, especially school-based preschool in the fall. We are hoping for that if it's safe, that children can be fully enrolled and we can serve the same number of children with the same dollar amount. But that does wait to be seen, and we will be advocating for the best use of these dollars to serve the most children in the safest way going forward. And then home visiting. Home visiting's 2 programs, Parents Too Soon and Healthy Families, were level funded again this year. the governor does have a goal of serving 12,500 new children in home visiting over the next 5 years. Unfortunately, the level funding to both the home visiting lines and the early childhood the early childhood block grant lines is gonna delay that. I believe. I mean, hopefully we do get more money in future years and we can accelerate back up to that 12,500 new child goal. But you know, it doesn't. It's looking increasingly like we're not going to necessarily serve more children going forward in this fiscal year. But we can hope for the next, and we can continue to advocate for serving more children going forward. Other budget items that I think you all might be interested in. So last year, before the FY20 fiscal year, there was a capital program. It was over $40 billion was passed. In it was $100 million for early childhood capital grants to help build new programs and enhance current programs, retrofit, provide, you know, the idea is to increase capacity for children birth to 5 across the state. The previous capital bill 10 years ago had 45 million for early childhood programs, and the request exceeded $500 million. So hopefully we have the same type of reception going forward. When those RFPs are out, we will certainly keep you up to date on how you can apply. Next, there was $270 million appropriated for the child care restoration grants. This is out of federal dollars, out of that $636 million that I mentioned at the top of this presentation. 270 million of that at least is set aside for child care programs. This will you know, take the place of the attendance exemption, or at least partially take the place of that going forward. We want to ensure that programs can stay open, as well as meet all the new health and safety requirements that come with the Restore Illinois plan. And that this money again has to be spent by the end of December. So, you know, hopefully it ends up being a lot of money per program to help them meet the new requirements going forward. And then the last budget item I do want to mention is there's $14.5 million was appropriated for census outreach activities. They had $28 million for FY20 because there was some delay in Illinois, but also across the country, getting having door-to-door meetups, having meetings, having presentations, in-person meetings around census outreach and activities. The state decided to appropriate some more money in this fiscal year to make sure that there is enough outreach to make sure that Illinois gets a full count on their census. And then, you know, just a quick plug here on the state budget. I did mention that, you know, we have a big shortfall, that part of it's going to be covered in borrowing, and there still is a shortfall. This year we will be pushing hard this summer and fall on the fair tax. The fair tax would raise about over $3 billion annually, while 97% of people in this state receive a tax cut or pay no more in taxes. That is a lot of money, with not a lot of hurt for the, you know, most vulnerable children and families. In fact, most families that we're talking about are going to have a tax cut with this plan. So we'll pitch a webinar for this later, but I just wanted to let you know that you can see how annually we can make up the budget shortfall we're talking about fairly quickly, and then even use some of this money to invest in the programs we just talked about that were flat funded, with just a seemingly a minor change in the way we collect revenue in this state. So please vote on this in November, and we will talk about it. We will have a longer webinar on this in the future. So thank you. Hope that all made sense. Again, please put your questions in the chat. We'll try to answer them at the end. And I will turn it over to Maria Estlin to talk about the Restore Illinois plan.
Thanks, Samir. So we are going to dive into some details around what restoring childcare has looked like, from phase 1 all the way to where we are now in phase 4. So you can go ahead to the next slide, please. Okay, so just to take us back and set the context a little bit, as we're all aware, back in March, Governor Pritzker issued a statewide stay-at-home order, which closed all non-essential businesses. And in that same stay-at-home order, emergency childcare for children of essential workers was considered an essential service. So those programs who chose to remain open and to serve children of essential workers were allowed to do so as an essential service. The emergency childcare structure was set up in just a matter of days prior to the stay-at-home order, when it became clear that that this was the safest route to go to do the stay-at-home order. There was a lot of work put in by the administration and the state agencies to set up an emergency childcare structure in which licensed centers had the ability to apply for a DCFS emergency license to stay open and care for those children of essential workers, meeting some enhanced health and safety standards or some restrictions around group size and things like that. And at the same time, licensed homes and license exempt homes, they could provide emergency childcare for these children, for up to 6 children, and remain exempt from having to get an emergency license. And the same was true for certain license exempt centers. They could offer emergency care and remain exempt from the emergency license too. And we don't know the full scope, but we know, just based on payments and the number of licenses that were issued and, through surveys and all the different ways we were collecting data, we know that at least, around 3,000 providers statewide provided emergency childcare for children of essential workers. And we hope, as we continue to flesh through data, that we have a more firm sense of that over time, but that's what we know so far. You can go to the next slide, please. So during this time, when we were in the emergency childcare situation, which was phase 1 and phase 2, phase 1 and 2, and then even into phase 3, when providers could open back up, we had several different types of financial supports that were available to providers, starting with emergency childcare providers could apply for stipends. And those were, one-time payments that were, not super big, but they were to help get some cash into the hands of providers that were staying open, to help them kind of, float for a month or two. And then the CCAP attendance exemption, which went through today, that meant that programs that were closed or open, no matter how you were operating during the time, programs that received the Child Care Assistance Program received 100% of their payments for based on previous months. Their enrollment of children who received the Child Care Assistance Program. So that attendance exemption, really helped some of those programs that do accept CCAP to continue to get that revenue, regardless of whether or not they were serving those children, but to help them, maintain and stay afloat during this time. But as Samir mentioned, that is ending, but we, have some additional financial supports coming soon, which we hope will take the place of this support. Also during this time, we had an enhanced CCAP rate, which is a 30% rate add-on for children of priority essential workers that were receiving care during this time. So, for those emergency providers who remained open as emergency childcare providers, if you serve children of priority workers, you got an add-on as well as, receiving your full CCAP attendance exemption rates for children who are not in care as well. And then also available to emergency childcare providers were free personal protective equipment boxes, that had things like thermometers, masks, gloves, lots of different things that the programs need to safely operate during this time. Those were available to emergency childcare providers, and as we'll talk about in a minute, we hope to see more PPE boxes available to all providers soon. So these are the financial supports that are available to families during phases 1 through 3. So everything we just talked about there was for providers, and now digging into what was available to families. Essential workers who would normally not be income eligible were eligible for CCAP. So, those are some workers who maybe were working in hospitals or other places where they needed to go to work, but they made too much money normally to receive CCAP. But this helped them to ensure that they had, safe childcare and a safe emergency childcare setting to have their kids at while they had to work, and that they didn't have to take on that financial burden themselves. At the same time, copays for all families on CCAP, so that included these priority essential workers who, became eligible for CCAP too. Copays were lowered to $1 a month for all families on CCAP. So that, provided some great relief for families during this time. And then automatic redetermination for families whose CCAP case came up for redetermination during this time. It was just automatically extended, and that is also coming to an end too, but that helped to make sure that we were not having any, lapses in paperwork, or that families weren't having to, take on the financial burden in the midst of all of this. Okay, so moving into phase 3 and phase 4, and as I think everyone's aware, we are in phase 4 now, but we just recently moved there. But during phase 3, all childcare was allowed to reopen, and so we're operating under the same standards for phase 4 as well. Phase 3 and phase 4 looks the same for childcare. We do know that now that we're in phase 4, that we'll see more childcare providers reopening as more people get more comfortable with it, but the guidance itself is the same. There were guidance documents issued by DCFS, Department of Children and Family Services, and these were informed by the Department of Public Health, as well as the Centers for Disease Control and Prevention. The CDC has lots of great guidance for childcare programs that remained open, childcare programs that are reopening, and all of that was used to inform the guidance that was put out by DCFS for licensed childcare to follow during phase 3 and phase 4. And the guidance document that's out, it can be updated according to public health developments and trends. Something that's really super important right now is that all childcare guidance remain aligned with best practices, informed by the data that we're seeing and informed by the public health community. As things change, we want to be able to be nimble and react quickly and respond to what we need to in our community. So that's great that the guidance, the goal of the guidance is to be able to do that. They hope to not be updating it, so frequently that it's hard to keep up, but if we do see a big trend that we need to follow, the department can be updating the guidance as needed. So some of the highlights from phase 3 and phase 4 guidance, is where we are now. Providers should submit their reopening plan to DCFS. If you've already reopened and haven't submitted that, it's okay, just submit it as soon as possible. But detailing, within this reopening plan, you detail how their program is meeting the DCFS guidance. And there's 3 overall plans that that make up, or 3 parts of the plan that make up this reopening plan, and in those plans are where you detail how you meet these guidance. So those plans are the enhanced risk management plan, a personal protective equipment operational plan, and enhanced staffing plan. So the point of the enhanced risk management plan is to make sure that your entire program is aware of what is your plan for if there's a COVID case that's that it comes back positive within the program, a staff or a child. What's the enhanced risk management plan should include, like the communication plan. How do you notify parents, if there's a positive case? Where do you isolate children if they get sick in the program? Things like that. So it's really focused on the risk management, mitigating risk within the program. And the personal protective equipment operational plan is exactly what it sounds like. How are you ensuring that staff and children have access to PPE? How are you ensuring that you're following the guidance on PPE, and staff are wearing their masks and children are doing so as tolerable? And how are you refilling your PPE supply when it gets low? How just making sure that there's a plan in place and that there's someone who's assigned to make sure that there's always enough PPE available, and all those things. And the enhanced staffing plan is to make sure that you have the staff available, as well as you've got their scheduling figured out in a way that you can maintain stable groups, you can maintain the smaller groups. People are qualified for the roles you have them in. So these are kind of the plans that you have to have in place to then help you think through to help you meet all of the guidance that's detailed in the DCFS guidance. So, onto the second point, some more highlights, smaller and stable groups. So there are smaller group sizes in place during phase 3 and phase 4. These are not as small as they were during emergency care, but it's also not full capacity. And the point of this is really to lower exposure. The public health community feels really strongly that you can't social distance necessarily in a childcare setting because children are young and they don't quite understand. But so our best bet is to just lower their exposure. The fewer people that they come in contact with, the better. The fewer people we all come in contact with, the better. And if they're the same people every day, then we're just ensuring that we're not spreading our circles too far. So that includes the stable groups really refers to children and staff that are assigned to these groups. And then, daily arrival and departure procedures. How are you ensuring that, daily health checks are happening upon arrival? And that includes staff, parents dropping off, children as they come in. Are we not only taking their temperatures, ensuring that no one, with a fever over 100.4 is coming into the center, but also are we taking a log to make sure that we have kind of that available for contact tracing if we move forward and we have a better contact tracing system set up. Childcare can really help us see when people were coming into centers or homes, things like that. And PPE should be worn in the facility. This is, the Department of Public Health has said over and over again, the most effective strategy we have at slowing the spread of this is masks, and it is wearing PPE. Recognizing that is a struggle when we're talking about young children. So being realistic about it, and when it's not tolerable, it's not tolerable. But every attempt should be made to meet PPE guidance within childcare. Enhanced cleaning and disinfecting procedures. This is, a no-brainer. I think we all know that. I think we're all doing this around our own homes as well. Just making sure that we're cleaning up regularly, using disinfectant regularly, and as intended to do so. This also refers to things around the toys and the materials that we have in our programs. This is a time to really make sure that those toys that aren't easy to clean, like stuffed animals and soft plush toys, those shouldn't be where children are, playing with them and then spreading them and then sharing them, because germs can just travel really quickly on those. So there's guidance around that. And then there's also guidance on communication plans, like I mentioned earlier, within your enhanced risk management plan, thinking about how are parents notified of a positive case in childcare? How do families notify a program if they're, if the child has a case that's positive, or if they've been in contact with someone else, like in the family or in the near, their close circle that has tested positive. How is that being communicated? And identifying staff responsible for identifying or notifying the local health department and DCFS in case there is a positive case. All those things are the things that providers should be taking into account and planning for within their reopening plan. And if there are more questions on other specific parts of the guidance, please stick them in the questions box, but those are kind of the big highlights. And so in terms of financial resources for phase 4, which is where we are now, as Samir mentioned, the child care restoration grants, which come from the business interruption grant program. And these are the federal dollars that we were talking about, $270 million at least for child care. These should help providers cover the cost of lower capacity and meet additional standards and guidance, all those things we just talked about. And it's really important to note that the goal of this, a lot of the supports that we had made available earlier, went through the public funding streams that we already had. So they were, for child care assistance program and things like that. The goal of this is to really make sure that we're also reaching those programs that don't necessarily have child care assistance program dollars flowing to them or other public streams. We really want to make sure that we're reaching the broader child care system with these funds. So they should help providers cover these costs, and then they're also thinking through what other ways they can reach providers. And I should also, again, note that there's also work being done by the state agencies to hopefully identify a way to get PPE to programs for, at least a lower cost, if not no cost. So I think those are the highlights from the Restore Illinois. But again, if you've got specific questions on things, please put them in the chat box, and we're happy to answer as best we can. But for now, I will turn it back over to Samir.
All right, thank you, everybody. Thanks. I see some questions flowing in. I've been making some notes, so please, please continue to ask questions. It looks like we are going to have some time to go through as a lot of them. But I did. We wouldn't be an advocacy and organizing organization if we didn't tell you what you can do going forward. So we're going to talk about some opportunities for you to engage in the next few months. So first, I want to make a plug for our Early Childhood Funding Coalition. As many of you know, the governor's office did create an Early Childhood Funding Commission, which is tasked since last December over the year to come up with a better way to fund early childhood programs and to really settle on what children need and how much does it cost. And while that commission's working, we have a coalition of advocacy organizations and providers who are trying to help influence that commission in the decisions that they're making. By the fall, they're going to have some pretty detailed plans, and with their final plan coming out at the beginning of next calendar year. So if you're interested in that, we will have a webinar going forward. In the next, I believe by the end of July, we're going to have a webinar, and then we do have monthly coalition meetings where we talk about how to spread the word of the importance of early childhood over social media, how to engage with the commission, how to testify in front of them, and how to better influence them and what we need going forward. So please look out for that. Don't forget to complete your 2020 census. The completion period has been extended, but that doesn't mean that you have to wait till the deadline. You should complete it now. And if you are a program that's open and you have families coming in, you should be talking to them about filling out their census. Enumerators will be going out. They were supposed to be going out in July, I believe. That has been delayed. But please do fill out your census. You can fill it out online. You could fill it out over the phone. You could fill it out over through the mail. So please fill out your census. It matters. I told you that Illinois received $118 million of the $3.5 billion that the feds appropriated for childcare. Illinois got $118 million. If we properly counted everybody, and we had a larger population, we would get more money out of that. So it is really important that is a direct consequence of filling out your census form. So please do that. And then related to that is vote. Register to vote. There's more ways to vote now than there ever have been in the past. Requesting an absentee ballot is going to be easier than ever. You're actually going to get a form mailed to you 3 times in the next few months. So you can request an absentee ballot. You can complete your absentee ballot well before the election on November 3rd, I believe, or you can just wait and turn it on the day of. If you want to wait till the last minute to find out what all the candidates are saying, you can wait. But it is really important to get that request in. If you've seen in other states that expanded vote by mail because of the pandemic, many people did not receive their absentee ballots on time because they requested them too late. So you can request these as early as as you need to make sure that they're printed and sent to you, so you have plenty of time to review the candidates, fill it out, and send it in. Voting by mail is safe, and it's there's not a lot of fraud. So please, if that's how you want to do it, but remember to register to vote, especially if you've moved or never voted before, which I hope you all have. Please do that. And then I think lastly, we have a bunch of events coming up. Unfortunately, they will be virtual. You don't get to see my smiling face in person. But like I said, the first one we're going to have is an introduction to the Early Childhood Funding Coalition. It will be in July, so please attend that. We will be doing a presentation in the next month on winning the fair tax for Illinois. Like I said, it's over $3 billion of revenue for the state. We're only increasing revenue from the top 2.7% of earners in this state, which is those that earn over $250,000 a year. Not gross net. So after all your deductions, if you still earn that much, you would get a tax increase. But just increasing taxes on those families raises well over $3 billion a year. It is really important that the state get that money so we can actually invest in things like early childhood funding. So be on the lookout for the webinar on that. We are doing, as we do every 2 years, we're doing our voter registration drive. We will have a guide and toolkit out, and we will be doing a presentation on that. National Voter Registration Day is September 25th. We will have this guide and everything out before then. Hopefully things are moving well and safe, and you are providing care in your program, and you can help have a voter registration drive actually on your site to register staff and families to vote. We have our strategic plan that we were gonna come out with in the spring, but then COVID hit. So our strategic plan is called All Children, All Families. We will be having an event on that in the fall, likely September or October. And then, of course, our annual regional Fall into Action meetings, which we used to call caucuses. Those will be happening this year as well. Even though they will be virtual, we still hope to make them regional, so we can really discuss regional barriers and ideas. This state is 4 hours wide and 8 hours long, and it is very the needs of the regions are very different. So we like to make sure that we're highlighting that through regional meetings, and we will be holding those again this fall. So I think that's exciting. That gives us a lot of work to do this summer and fall. Hopefully you guys are all in and want to do this work with us. So thank you again. It took us about 50 minutes to get here, and I will go through our questions. Maria, please be off mute because I think I might have to pass some of these on to you. So I made some notes. I'll go through the ones that are questions. So first, I did mention a nice pickup by somebody here on the webinar that the governor will have some expanded powers to reallocate dollars. In a normal year, the governor has, I believe it's the ability to reappropriate 2% of funds across budget lines. They expanded that, I believe, to 8% reallocation. And the question here is this any risk to childcare providers? And normally I would say no, because this governor and this advocacy community and everybody on this call have been very active in informing the governor's office and their legislators to not move money from early childhood programs. I will say though that this year, between the huge budget shortfall and the potential lack of demand for childcare, there is a risk that money could be moved around. So again, we really do have to redouble our efforts in talking to the legislature virtually and talking to the governor's office and making sure that this money is not moved. We will work on it as well. And if we get a whiff that they are thinking of moving money, you will certainly be notified and be activated to talk to your legislators about that. So thanks for that. Thanks for that question. Here's a question I think for, between me and Maria, I think we can answer some of this. Do we have any information on how many emergency providers received the stipend, the rate add-on, and PPE boxes? I think I can answer the first one. I believe nearly 3,000 homes and centers did receive the emergency stipends across the state. it was, well over $3 million were paid out to those programs. Remember, those stipends were one time. Hopefully for most of those programs that stayed open, they were able to use the rate add-on, the 30% rate add-on to continue, essentially as a rate stipend to ensure that they could serve families, keep lower group sizes, and do all the new health and safety activities that they had to do. I did hear from our resource and referral director that there was a bit of confusion around the rate add-on, and some providers did not receive it. My understanding is they can still apply it back to cases that they have already been paid for if they did not receive it. So, spread that around. If you work in R&R, we can discuss how to do that outreach as well. And then I'm not quite sure about the PPE boxes. I'll let Maria answer that if she can, but before she does, I did want to say that my understanding is there will be a PPE store available at some point for providers. We want to encourage providers to follow best practices in the guidance around cleaning and face coverings. So there will be some availability of those going forward. I don't know, Maria, if you have any information on how the like care package boxes of PPE were distributed.
So I don't know how many there were in total. I believe the administration spent, I think at least $1 million on getting them. So I'm not sure exactly how many that totaled to be. I believe that they were available to all emergency providers, but I'm not sure how many actually went out. And also I saw a question in here about, the process for doing so. And I can't speak to that. I would reach out to your R&R or to INCRA to find out more about that, and about any upcoming opportunities. That's who you'd be hearing from via your R&R.
Okay, thanks. If we have any more information on how many were out, but I think more importantly, I think you want to know how you can receive PPE. We will, it will be a big cost for programs going forward. And, from our perspective, having an individual provider shop around for PPE is not efficient at all. The state should have some way of procuring it and then distributing it to make sure that we are getting the right products, but also to make it cost efficient, not just in the price, but also the time spent trying to find them. So if you have a hookup to somebody who produces it, or a distributor or something, let us know and we can pass that information along. Let's see, I think we have a question here around policies that have been relaxed during this period that we'd like to see made permanent. And any we want to restore as soon as possible. Look, I think there was a lot of discussion around teacher educational requirements and group sizes on both sides. It's hard to find. There was already a staffing crisis, and during this time, it's hard to find staff. However, children everywhere deserve to have the best and the highest quality staff that they can. We also have to, realize that, a private program that charges $2,500 a month for an infant, the rules for them are the same for the rules for a childcare provider who's providing to some of the hardest to reach fathers from opportunity children, and that we can't lose sight that it is a full system. So I think over time we'd like to see the group sizes be smaller if possible. I think that it's hard to talk about that now as a policy because it's very difficult for providers to stay open at smaller group sizes without the revenue to cover the difference. And I do think that's one big reason why everybody should at least come to the webinar about our funding coalition. We need to make sure that children are in high quality places, and we need to make sure that programs are funded to provide that high quality and not just say, oh, well, you can only serve 8 kids and you have to have a master's level teacher and here's no money to do it. So all those go hand in hand. So, as we make some of the things more permanent and things restored, we need to make sure that funding goes along with it.
Samir, I see a question here that I want to pose to you because I think this is a super important one for people to walk away with. Question says, can you still apply for the Restore Illinois grant, the child care restoration grants? The website says it was closed June 24th.
Yeah,
can you please clarify?
So clarification on that. That was just an intent to apply survey. What the governor's office was hoping and INCRA was hoping to gather from that survey was what is the gap that providers are feeling right now? How many kids could you have served March 1st? How many kids were you serving March 1st? What is your new license capacity, and how many kids are you planning to serve? And to give them an idea of what the gap is, like how do we make sure that programs, even though they may be at serving half or a quarter of the number of kids they normally would, how do they still stay somewhat viable so that we can have programs open and our whole system doesn't collapse and children have no place to go. So that was the idea of that survey, to find out what the gap is and to be able to construct a program to give the proper amount of money to programs to make sure that they can stay open. So the actual applications have not been released. So yes, you can still apply because nobody has applied yet. And again, I do want to reiterate that $270 million over the next 5 or 6 months is a lot of money per program. So please feel that, there is a real effort here to make sure that the dollars you're going to get are not going to be, $1,000 here and $1,000 there, but it is going to be real money to help you provide care for children and meet the new health and safety standards. Let's see, they're going to be open. Copy of the slides. Yes, this is recorded and we will post everything. When will the capital monies be available? That is a great question. Maria is on that committee. I don't know if you have any thoughts or any ideas.
No, we had hoped, soon, but I think that the financial situation right now might delay it a little bit more. But as we learn more, we will be sure to put up more information, but we don't have a clear sense at this time.
Mm-hmm. Yeah, it did get delayed, although I think the original intent was to have something closer to the end of this year. I'm not sure if that's going to be the case now, but it is important, and we will press the governor's office to make that available as soon as they possibly can. There's a question about if we're going to get paid in July. Right now, you will get paid for your full enrollment for June, and that right now is not the case for July. However, the goal is to have these restoration grants. It's in some way, make up not receiving money for your full enrollment. We are seeing more children are getting back into care though, so hopefully that will help with that going forward. If you are still seeing a problem, please do not hesitate to let us know. And then a lot of questions about the big grant. Let's see.
There's a question around posters on how to protect from COVID-19 and washing your hands and things like that. The CDC has really great free printables that you can get to. If you just Google CDC childcare guidance and posters, they'll pop up. And also, I know that the state is working on getting some posters to be able to that programs could use like outside of their program to say like, don't come in if you're experiencing these symptoms, or like masks are required, those types of things. The state's working on getting some standardized posters for that as well.
Mm-hmm. And then there is a question about the governor's funding commission. So, by the end of July, a couple of the committees on that commission are going to come out with their initial recommendations. Providers were included. There was a focus group. So we were soliciting information on it as over a year ago, starting a year ago. And then there was, as they built the model, they did have a couple focus groups with providers. The last two that they had, which were less than a month ago, had like a total of 65 or 70 providers providing feedback. So again, this is the first pass. While recommendations will, the first round of recommendations will come out in July or August, they will do public town halls, public hearings, focus groups at every commission meeting. There will be time for public comment. So there is still a lot of time left to influence the commission before the final recommendations are made next January. And then let's see, there's a good question here on EI. How do we see it being effective? Providers, yes, EI providers are not going to homes. They are doing more teleconferencing. I believe that executive order was extended to allow for telehealth. I think this is a mixed bag here, right? I think that while therapies are most likely more effective in person, I do believe that travel is a big barrier to getting not only early intervention providers to children, but children to providers. We know providers do discriminate against certain neighborhoods and zip codes and do not get there. And telehealth, in some ways, teleconferencing for services does mitigate that a bit. Unfortunately, children do have to be screened in person. So I do think it's a mixed bag here. I think going forward, the one of the previous questions I answered about what do we want to stay and what do we want to come back right away. I do think that one thing we can be going forward is more innovative at delivering early intervention services, and I think this allows us the opportunity to study that and to see if teleconferencing actually does increase access and improve outcomes. So that'll be interesting to see going forward. Let's see. Somebody here would like to host. It looks like a voting activity. We're happy to help. We actually have a person on staff dedicated to helping with that. So again, look out for the next webinar. Is the stipend the same as a 30% add-on? That's a good question. It is not. In March or I guess it was early April, late March, there was a stipend program that was there to help programs stay open to provide emergency care. The 30% add-on was started, I believe, in April, and for anybody you were caring for in April, May, and June, that was an essential worker, you would get an additional 30% add-on on top of the CCAP rate. So they were different, and then you could have received both. The stipend applications, I believe, are closed now. I believe they just did their last payments a week or so ago, unfortunately. But the add-on is still available through the end of this month, which I guess is today. Let's see. So the question about the minimum wage will be going up tomorrow. There is no thought about rolling it back or freezing it. Families that are working now do deserve to make a living wage, and the minimum wage, unfortunately, is nowhere even close to that. So the minimum wage will be going up. We are glad it's going up. There will be a rate increase starting tomorrow that will 100% happen for homes, and my understanding is it's going to happen for centers. They're just finalizing the actual numbers, but for homes, it is a 3.5% increase across the board, and we're still waiting on details of the center-based rate increase. So that is happening. You should look out for that, the posters. And then let's see, I like this one, a public recruiting campaign for highly qualified teachers. I'm sorry we are 5 minutes over time. It looks like many of you stayed. I'm sorry about that. This will be, if you need to leave, feel free to. We will post the webinar online. Yes, we do need more qualified teachers. You know, we are going to be working on workforce issues as well going forward. And I did not put that on our webinars, but we will have something on workforce strategies going forward. So again, please be on the lookout for that. How do programs access the 30% add-on? Oh, non-pandemic related. I'm not quite sure about the special needs add-on. I will look into that and get back to the person that asked that question. Will private pay still be decoupled from state payments? I believe that is the new policy of the department. Again, I can get back to the person on that question. Any CCAP eligibility flexibilities for parents who are enrolled in the remote learning this fall? So that's a good question. You know, I do know that they've clarified the policy around if parents are working from home. I think that this is more about children who are remote learning, or parents who are enrolled in remote learning. So if you are in a class, that is a good question. Sorry, I sort of babbled around that. I see that. I will look into that. I think that's a great question. I think parents who are doing online learning are just like, you know, in some ways, parents who are working from home, they may need care while they're actually taking their courses. So we will look into that. I can ask the department what they plan to do and come up with the policy. What about parents that receive unemployment? So I did find out about that one. Parents will be parents' income when they apply for childcare will only be on their base unemployment and not on the pandemic, the additional dollars they're getting for the pandemic unemployment insurance. So if you were eligible for childcare before on your unemployment, you are likely still eligible for childcare if you don't count the additional dollars that you're receiving for pandemic, which I believe run out at the end of July. So rest assured, you should be okay. Also, if you are unemployed now, but you were employed and your case is still open, you can still get back into childcare. You may need to call your resource referral to just notify them that you're in your job search period. But not to worry, you still have at least 90 days of eligibility on childcare, even if you are unemployed, if you had an open case. So we can have a longer discussion about that at another time if people have questions. And then lastly, before we go, somebody did ask that said I broke up around the childcare restoration grants. Those will be available hopefully soon. The application will be out soon. And, you know, I'm not sure what the timeline is, to be honest, but the application should be out in July for sure. So sorry I went through that very fast. This is being recorded. It will be available online. You can email me. All of our emails are on the website. We will also make sure that they are easily available when you get to this, when you go to view this presentation. So thank you again. I appreciate all of you being here and taking a little bit extra time out of your day to listen to me answer all these questions. So be on the lookout for this recording as well as future webinars. Thank you again. Have a great day. Thank you to Maria for being a part of this and answering all your questions as well. So have a great day. Have a great weekend. Happy 4th. Goodbye.